This is Dr. Narendrakumar from Chennai. Will be demonstrating FESS case. AFRS was present inside the frontal sinus, which was removed, and the case presented with severe headache and periorbital pain on the right side and more on the left side too. So, the endoscopic picture shows some polypoidal tissues present in the middle meatus, which is debrided. To start the surgery by regaining the normal anatomical structures. So this uncinectomy was a first procedure. Opening up, you can see some polypoidal tissues and mucopurulent discharge present inside the maxillary sinus. Widening up the maxillary sinus is very essential. Using the through-cutting forceps, still more, we have opened up the maxillary sinus. Type 2 maxillary sinusotomy was done, and we can see the polyp which is present inside the maxillary sinus, which will be addressed at last of the surgery. The essential is to open up the frontal sinus to remove the fungus from the frontal sinus. Simple way is keeping the gauze and pushed superiorly. From now we will start using a 70-degree endoscope with all frontal instruments. More polypoidal tissue present in the frontal recess has been debrided. Finding out the ostium of the frontal sinus was a little difficult in this case, but the easiest way is to track the disease. Just the AFRS, the mucopurulent discharge, will lead us to open up the sinus very easily. So initially we started by keeping the bulla intact, and after that we removed the bulla for the wide axis too, until you will see the ground lamella. We not open the posterior ethmoids, which is not needed in this case. So the lamina papyricia and everything was seen. Just keeping a curved instrument with 70-degree endoscope, we started giving a wash. Giraffe forceps has been used to remove the polypoidal tissues. You can see granulations, polypoidal tissues obstructing the frontal sinus. Ostium has been removed slowly by slowly. It takes time. Frontal sinus surgery is a tricky one where you have to use a very curved instruments to proceed to open up the sinus. You will see the fungus which is present inside the left frontal sinus, giving the patient a severe headache. So this can be possible only with the angled instruments. So if you receiving the avascular plane, just the fungus will lead us to the sinus. Simple trick. And removing the fungus, the best and the easiest way is giving wash. So now our role is to widen up the frontal sinus to the maximum and give the wash so that the fungus will come out very easily. This video is a crispy video, but it took much time, and we did a repeated wash. This will make sure that we have to remove the fungus completely. You can see how superiorly the fungus was based. So The places where the instrument can't able to reach, no problem, but giving the wash is the simplest method which will remove the diseases. So now you can see that the fungus is getting removed. This is with the mushroom forceps, the curved one, the frontal mushroom. Use it wisely to open up still more. Now the beautiful picture of the frontal sinus is seen. The remaining fungus is again, as I said, wash, wash and wash. The large chunk is also came out. The granulation and the polypolar tissues, which makes the ostium closed, this also has to be removed with the help of the curved debrider blade. Make sure that diseased tissues has to be removed and has to be biopsied. The same procedure, widen up the sinus, give a wash, widen up the sinus and again give a wash. Slow by slow, repeatedly, and that's it. You'll get a maximum removal of the fungus. This is possible only with a curved instrument. The frontal instruments is very important, and using the frontal instruments is a little tricky. You can see the last part. This video shows exclusively how to handle the frontal sinus diseases, how to widening up, and you can see the disease is completely removed. So the remaining polyp which is present in the maxillary sinus, the use of 70°, we can remove it. And this is a picture, shows very beautiful picture, and this will elicit the Friedman sign, that is a glow of the frontal sinus. Sometimes you can do a reverse one also in a very safer mode, where the light source has been kept over the forehead with a distance between the skin, and you will see the reverse Friedman also. Make sure that you should not touch the skin, and the duration should be very small duration. This is just to exhibit, and this is a final picture of the patient free of the diseases, very widened frontal sinus. Thank you all for watching this video. Thank you all.